The European Union's Health Security Committee has called for the bloc's member states to coordinate and roll out joint measures against COVID-19 as China reopens its borders. The meeting came after Italy, which was hit hard by the first wave of the pandemic in early 2020, ordered mandatory COVID antigen swabs and virus sequencing for all travelers coming from China. Similar measures have been imposed by other countries such as Japan and the US, amongst others. We're now joined via Zoom by epidemiologist Dr Jo Barnes. Dr. Barnes, always a pleasure to see you. Thank you very much for joining us.
Good afternoon, and good afternoon to our viewers.
Let's start here. I mean, how worried really should we be here in South Africa now that, nations across the globe are starting to consider these stricter measures as it relates to travelers from China? And should we also start to think about the emergence of new variants? I mean, we're kind of, for lack of better words, sort of stuck on, the Omicron variant. Where are we now, and where are we likely to be?
A virus like this, like the one causing COVID-19, mutates all the time, and it changes its outer coat all the time. Most of those changes do not go any further or anywhere. Yeah. And here and there, one slips through that are more dangerous than the others. So this BF.7 is a variant of Omicron. So we are still with Omicron, and it has spread in China massively, but it had started spreading 3 months ago. And even the Chinese government and the World Health Organization admits that China has lost control of this, and they have no idea how bad the situation is because they've almost stopped testing. They cannot keep abreast of the situation. Yeah. But there has been 3 months now, and it has not spread to the rest of the world, and it seems almost as if there's another factor in China that's causing this vast upsurge of cases, and there's a lesson in that for us. China went for a very hard lockdown, zero COVID policy that they, in fact, brutally enforced to the point where there were almost unknown riots in China about it. And it hit the economy extremely hard, very hard. So China suddenly, when these riots and the economy tanking hit together, opened up at an incredible speed and even urged people with mild symptoms to come to work. So they've made policy decisions that I think has worked into this sort of perfect storm. But there are lessons for us in there, you are right.
Yeah. Dr. Barnes, it seems though, while you're talking about it sort of spreading in China, that China itself at the moment is dropping, some of its COVID restrictions, particularly when, coming to, travel routes, long travel routes. This isn't necessarily a good idea now, is it, considering what we may be then faced with, and very different really to how China has behaved in the past whenever we've been talking about COVID-19. What do you make of China's behavior? You kind of started touching on that briefly in the previous answer.
We need to learn from these things. South Africa is a civilized, middle-income developing country, and we need to make sure that our inhabitants are safe. And we can do that by urging and making much more of an effort to get people to vaccinate themselves. China went the other way, and they actually locked people inside their blocks of flats. They couldn't actually even get out at all. So the vast majority of the rural areas in China have got, first of all, poor medical services, public health services like us, and they were not exposed to COVID-19 ever at all. And now, after 3 years of being locked in, suddenly this thing is spreading so much. So I don't think, first of all, that we need on BF.7 to be that concerned like any of the others, but it's a very good idea to take note that we need to improve our public health services and particularly in the rural areas, and to inform people better about the risks.
Yeah. And, speaking still about China, I mean, we're talking about a country that had, one of the hardest lockdowns for, the longest period, the strongest restrictions. I mean, there might be an argument that comes and says, well, do lockdowns then work? Do they serve the people? If a country that was so strict is still, as you earlier mentioned, struggling to contain the virus, does that argument sort of hold water then?
It doesn't work very well if you lock people in buildings and they can never get out, and that they've lost control over first the testing, so they don't know what they have, and that the percentage of people vaccinated is also very poor, particularly in the rural areas. So you can't do the one and not the other. They thought they could lock people in to their homes for years, because it's 3 years now that they've been doing it, and then not do any of the others. And that was, I think, the fatal mistake. We had a much shorter lockdown period, but what we are falling down on is the second half, and that is to get people to not only vaccinate, but keep those vaccinations up to date, and to make sure that people understand the risks. It's, most of our so-called education about this was just a series of orders. Wear a mask, do this, get vaccinated. There was no explanation so that people can understand how the system works. And that is where I think we did not get the cooperation of the population, because we lost them.
And the fact of the matter is that there's still, many people who, in fact, haven't been vaccinated to begin with. So even though we might be talking now about booster shots and so forth, there's a large, a group of people who just haven't vaccinated altogether. Is that message still being put across, properly and thoroughly? I mean, I must say I've kind of lost it, at this time where people were being sort of pushed to vaccinate. And right now I'm hearing about boosters, but some people just haven't vaccinated at all.
You're quite right. I entirely agree with you. We've actually, in a way, lost the plot. And lots of people, because there's no or very little attention to it, now thinks, oh, well, now it's just like the ordinary flu and we can ignore it and go on with our lives. We're lucky at the moment we're in the summer season. So many people are more outdoors and they're not as close together. Come winter, when it's cold and everybody huddles inside, it may be a different story. So I'm very, very wary of letting go of getting people's cooperation and getting them to be vaccinated too soon. Because a vaccine and the vaccine campaign is a lot cheaper than having both our ICUs, our mortuaries and our hospitals overrun. China does not know what to do with all the dead bodies. In the cities, they do not have mortuary space anymore at all. So many people are dying. Yeah. So I really wanted to say that putting our shoulder to the wheel and doing something about vaccination is going to be, in the end, not only the more ethical choice, but also the make more economic sense.
All right, Dr. Jo Barnes, always a pleasure talking to you. Thank you very much for giving us your time here on SABC News. We appreciate it.